So I had the pleasure to present in the presidential session the results of the HypoGeo-1 trial, which is a randomized phase 3 trial assessing moderately hypofractionated radiotherapy for nodal irradiation in breast cancer. So up to HypoG, we had quite a number of trials showing that hypofractionated radiotherapy was doable and non-inferior for breast-only radiotherapy. But we had no previous trial with modern radiotherapy assessing the hypofractionated radiotherapy, so shorter regimens, when irradiating not only the breast but also the lymph nodes around, so for a little bit more advanced disease. And so with this trial, we have demonstrated the non-inferiority of a 3-week regimen, so an hypofractionated regimen, compared to the still standard in most countries 5 weeks radiotherapy when irradiating the nodes. And we have demonstrated that on the primary endpoint, which was based on toxicity, so the cumulative incidence of arm lymphedema. And numerically, we have shown that we have no obvious difference between moderately hypofractionated radiotherapy and normofractionated radiotherapy, no matter which type of toxicity we look at. Cardiac toxicity, lung toxicity, local toxicity on the skin, also fatigue, everything was pretty similar. And regarding survival, we also have very interesting data in terms of overall survival, cancer-specific survival, disease-free survival, because we saw, for instance, an overall survival hazard ratio of 0.59. So with that, it makes a big change in practice, because now we don't need any more long radiotherapy over 5 weeks. Just 3 weeks will be enough, and not only, as it was shown in the past, for breast alone, but also for patients with a little bit more advanced disease requiring nodal irradiation. Well, we will have the follow-up up to 10 years of the patients, of course. And of course, regarding cardiac toxicity, we will also analyze the dose distribution of radiotherapy to follow up on the long-term run. So we really think that this will change the practice in most countries, and there is another trial running, now ended, which is the SKAGEN-1 trial, and we hope to publish back-to-back the results. So having 2 randomized phase 3 that we hope will be showing the same thing will really consolidate these results and make no doubt about the fact that no matter the ethnic origin, no matter the size, the weight of the patients, this would be applicable for all patients. Maybe just mention that this is the HypoGeo-1 trial is a fully academic founded trial, and so that's really nice to see that even with academic funding you can reach a change in practice. So yeah.